So I am currently 14 weeks pregnant. So that means I am off the hook for the first trimester. And as a registered dietitian and a woman who's experienced first time motherhood, this is the second time, I am going to share some of the common symptoms amongst most women for the first trimester and how you can use very simple strategies to actually make sure that you sail through the first trimester smoothly. So majority of women actually experience morning sickness. This is basically the feelings that you feel like you want to vomit, nausea and all that. It actually affects your food intake, which might compromise intake of various nutrients that are very key during the first trimester, like folate, iron, calcium, and this can compromise the development of your baby. So I did not experience morning sickness. I was basically okay, but of course I experienced some other signs and symptoms that I'm going to talk about. So how do you manage morning sickness? Of course, it is actually encouraged that you have small frequent meals instead of the 3 large ones that we are used to. You know, in Kenya we take breakfast, lunch and dinner. Apart from that, you can also just listen to your body. When you're feeling much better, you eat at that particular time to actually help you increase your food intake. And of course, it is actually recommended that you avoid skipping meals. You don't have to align with what you used to have, but do not go for long hours without foods. And of course, you can sip on ginger or lemon infused water to calm nausea naturally. This is very important because apart from the fact that you're increasing and improving your hydration, which dehydration is another common symptoms of pregnancy, like I have been taking water like a camel. Once they see water, I take a lot of water. Apart from that, lemon and ginger actually give you additional nutrients. Like with lemon, you get extra vitamin C that actually aids in the absorption and utilization of iron in your body. And of course, another common thing that I experienced, this one I experienced badly, it was the constipation. Not constipation really, but bloating. I did not constipate because I think my intake of fiber was quite good. And as I've told you, I'm drinking a lot of water. Even with the second trimester, I am doing those exercises for pregnant women to ensure that my bowel movement is taken care of, but I still experienced bloating. And this is basically due to the increased progesterone that relaxes smooth muscles, including the intestines, and this slows down digestion, and this can lead to the bloating and the constipation that is common in the first and the second trimester of pregnancy. If you were doing like 2 liters when you are not pregnant, at least purpose to increase for at least 500 ml every month in your pregnancy so that you can be taking care of your increased fluid needs. And remember, you need to make sure that the baby is having enough amniotic fluids, your blood volume is adequate enough, your metabolic health, and if you don't hydrate properly, you're going to have issues with that as well. And of course, there's also the emotional changes. I had my fair share of those ones where I will get so mad, I will get so angry, irritable. It was maybe, it's calming down now. I think one of the reasons that people have these emotional changes during the first trimester might be because of the shock of the pregnancy. I think if you had planned your pregnancy, you might get a bit excited about it. If you had not, you might actually get a bit shocked. So mood swings, anxiety, or loss of appetite and such. Me, I did not lose appetite in my first trimester, we thank God. But again, I was also over junking and over snacking, which led to the weight gain. I have gained like 8 kgs, which is quite unfortunate, but I will try as much as I can moving forward to make sure that I do not do that. So what do? You practice stress management, you walk, you share with a friend. I know for most women, we might not be ready yet to share the news with the world. You want it to be a bit secretive, you want it to be just you and your maybe close ones or your loved ones or even yourself. Sometimes you want to keep it to yourself, but if you can share with someone, it is highly recommended. And of course, there's also the aspect of food aversions and cravings. I think I was craving lala or mala. There's that Brookside lala. I used to drink a bottle every single day. It wasn't a bad craving, of course. The chipomi too, I was having them a lot. So when you're doing the aversions and cravings, when you're assessing them, try as much as you can to just look for alternatives. I know it's not easy. You can bake your potatoes. You can do the lalas. Lalas are good. They're great for probiotics, and they're also great for an extra calcium, vitamin D, and also protein that you need to ensure that you're keeping your pregnancy and your baby developing effectively. Because proper nutrition in the first trimester actually helps with healthy organ formation and foundation, and it actually helps prevent neural defects. And of course, it also helps to maintain and ensure that you have optimal blood flow and oxygen flow to the developing baby, and it also helps the baby attach effectively for proper development and to actually ensure that you transition effectively to the pregnancy. And of course, it also helps improve the maternal immune system, and this actually reduces the occurrences of opportunistic infections like colds and such. When the body's demands are increased and they are not supplied, your immune system can be compromised. It is not a good thing to be sick when you're pregnant. And of course, it is very important to reduce complications later on in pregnancy. And of course, another thing that I want you to emphasize on in your first trimester is hydration. So hydration actually helps reduce the occurrences of UTIs, of course, with proper hygiene, proper nutrition, reducing sugar intake, making sure that you are taking care of your private area well, you're shaved, you are wearing good panties, and all that is very much recommended. Those were some of the signs and symptoms I experienced during my first trimester. And as we go through the journey, I'm going to try to get snippets here of my routines, what I eat in a day. Maybe I can do a video on that, what I eat in a day as a pregnant woman, and I don't overeat it because I'm trying to make sure that the pregnancy weight is kept at bay. I don't want to blow up because I've told you I've already gained like 8 kgs, and I'm really trying to make sure that in the next like 5 months I'm gaining only 1 kg or at most 1 kg per month. You need to pray for me, and you also need to tell me some of the symptoms or some of the signs that you actually experienced during the first trimester, or some of the things that actually told you that you might be pregnant. That is what the first trimester is all about. And another thing, did you plan for pregnancy? And if you did not, in your next pregnancy, will you be open to planning for pregnancy? Let us know in the comment section, and let's continue the conversation. Bye.